is Dr. Aysha, one of the mentors of StudyMEDIC. Today we'll be discussing about the module Urogynaecology in this Back to Basics series. So I wish you all the very best in this exam, and we will see what is there in Urogynaecology module. So we always start with the quote of the day. This is a quote by Michael Jordan, who says, "I've failed over and over again in my life. That's why I succeed." So the success is a key here. So don't worry, even if slight mistake in your exams, you will always succeed. So in urogynecology, what are the type of tasks that are tested? You have three types, that is patient-simulated task, structured discussion, and teaching station. So domains assessed are information gathering, communication with colleagues, communication with the patient and relatives, patient safety, and applied clinical knowledge. It's the same in other module 2. So what are the type of potential tasks in this module? Either it could come as a stress urinary incontinence. It could be patient-simulated or structured discussion also. Overactive bladder, mixed urinary incontinence, bladder pain syndrome can come as a patient-simulated task with lay examiner. Vesicovaginal fistula, again, the structured discussion. Urethral diverticulum, again, structured discussion. Fowler syndrome. POPQ can come as a teaching station. Mesh erosion could be a lay examiner tested task. Wall prolapse. Postpartum voiding dysfunction, and teaching stations like pessary teaching, teaching urodynamics, and interpreting charts. So the template would be in the urogynecology as always in other module 2. First would be introduction, whether it be a structured discussion or patient-simulated task. Could have a good introduction of yourself and then greet either examiner or the role player. Make an agenda and the history of presenting illness. Always, ask about the present symptoms, like if she comes with a urinary leakage, since how long do you need to rush, whether it is during jumping, coughing, sneezing, or it is associated with pain, or if the pain is relieved by passing urine, and what is the intake of fluids like coffee, tea intake, nocturia, number of episodes. So you need to ask all this history in case if she's complaining of urinary leak. If she complains of mass per vaginum, then you need to ask what type of mass, since how long it has been there, whether it is reducible, does she have any difficulty in voiding and defecation. And always when you're asking such type of symptoms, be empathetic, because it might, involving it might be impairing her quality of life. So always when you ask such type of questions, just make sure that you utter some sentences like, "I'm sorry, you're going through a lot," in case of patient-simulated task. Sexual history, always in urogyne, you need to signpost and ask, okay, about the difficulty, especially when she's coming with stress urinary incontinence and as well as mass per vaginum. Always never miss sexual history in case of urogyne module. So these are some of the asterisk points which I'm trying to tell you. Obstetric history becomes very important in case of prolapse, like parity, whether it was difficulty delivery, and what was the weight of the babies. Menstrual history, smear history, again, is equally important. Medically, whether she's diabetic, whether she's hypertensive, any thyroid or neurological cases, or chronic cough, all these can lead to some stress urinary incontinence or overflow incontinence. So make sure you have to take all these histories. And surgery, any pelvic surgeries or perineal tears, personal history, smoking, alcohol, recreational drugs. Never forget to ask about the personal history. Occupation is very important in urogyne, like heavy lifting may lead to prolapse as well as urinary incontinence. Mental history, equally important. So let's see 3 cases here in this module. So the first case is a patient-simulated task will be assessed on information gathering, patient safety, communication with colleagues, and applied clinical knowledge. So you will be allotted 2 minutes outside the cubicle to read about the case, as well as 10 minutes to present the case. In this 2 minutes, what are you supposed to know? That's equally important. First of all, I would like to tell you that you need to see what type of task is it, whether it is patient-simulated task or structured discussion, because we don't want the candidates to go inside and wish the examiner like, I mystify, uh, uh, and presenting like a patient simulated task and vice versa. So this is a situational awareness. So I would like to say that make note of that, note of the type of task in the first 2 minutes when you get the cubicle, when you before entering the cubicle. So this was a patient simulated task. Make note of that. And it says you are testifying gynecological clinic along with your consultant. Your consultant has asked to see the next patient as he's called for an emergency. The next patient is Mrs. Deborah, who is 56-year-old, come with complaints of mass per vaginum. She's really worried and upset with it. It's affecting her quality of life, especially sexual life. She had total laparoscopy hysterectomy 4 years back due to irregular vaginal bleeding. So your task is to take focus history and address her concerns. So first 2 minutes, what I'm going to do outside the cubicle is equally important to make note of the important points here. So she is, you know that she has come to see the consultant. So the first thing would be to apologize, saying that the consultant is away. So you mark that in your paper and say that, okay, I'm going to apologize first. And then take note of the patient's name, because that is also patient safety, proper identification, and calling the correct patient with the correct name, as well as knowing her age. Okay, these are the important points. Then you have to go according to the template which I have discussed in the earlier slide. So this is the role player instructions which you will not get in the exam. So this is she's married to Adam Brown, who's 58-year-old, and she's two children. Very she's upset because of the mass per vagina. Initially it was mild, now it has come out and has a dragging pain. It's affecting her sexual. She also experiences leak while she coughs. So here, information gathering, how would you go? Especially here, first thing is to apologize for the consultant being away and then ask her what type of symptoms. Here, you will ask about the mass per vaginum, when did she have it, how it is affecting her quality of life, whether it is whether she's having any bowel or bladder movement disturbances. That's equally important. Then you need to say sorry for the quality of life experience. Ask about recovery after surgery and medical and lifestyle history, empathy and support. And you need to ask, for example, if she says that I'm not willing for surgery, explore the reasons for not willing for surgery. Okay, whenever you ask for something and they do not agree with it, you need to explore the reason why they are not willing for it. And one more thing, always go with the agenda of the role player. Never you force them to do something saying that, okay, this has come out, you need to do, uh, you know, um, a surgery. But she might say, I'm not interested in doing surgery. So you can say, I respect your wishes, and we have some other options also available for you. Then talk about the pessary, talk about the pros and cons of pessary. So once she knows about the pros and cons of the pessary, then she will, agree to the surgery. Because this station goes such a way that she's come with a mass per vagina, but she doesn't want any surgeries. So communication with the patient, how it should be, you have to be very empathetic, explain the condition after mild BBN. So say that, I can see that you're alone. Do you want somebody to be with you? If she says no, then you can just say that I have some news which might be concerning. You can see that the top of her vagina has just come down after surgery. I'm very sorry. It might require some corrections. Uh, it might require some surgery too. And if she says, no, I don't want surgery, then you can say, I respect your wishes. We also have what is called a pessary, wherein we put a plastic-like ring inside your vagina and keep the top of the vagina fixed. But I would like to say that it needs to be changed every 6 months, or else it might lead to some infections, and also it can, erode the tissue surrounding it. Am I clear so far? So give information in chunks. Show sensitivity to patients for her emotional state. So this is what they are looking in communication with the patient. Now, applied clinical knowledge is explaining the condition of wall prolapse. And you need to talk about the pelvic floor muscle exercises. Pessary can be used if unwilling for surgery. Then you talk about the surgery to treat wall prolapse, that is sacrocolpopexy, vaginal sacrospinous fixations, and colpoclysis. Here she is coming with the complaints of sexual disturbances. So you can just say that we have some surgical options for you, wherein we will lift the top of the vagina and fix it. Either we can do it through the tummy or through your down below, that is the vagina. And we also have some other surgery wherein we close your vagina, but since it will hinder with your sexual activity, it might not be suitable for you. So this is where you will explain to the patient. Coming to the patient's safety, taking proper history, excluding allergies, examination in the presence of chaperone, coming to proper diagnosis and explaining the condition in a very simple way. And then telling the patient that pessary, even if she's putting, then it needs to be changed every 6 months and take consent for surgery. So this is the basic which I want. Marks are given according to the domains. So information gathering, first of all, quality of life experience, and the rest will follow. Communication, the patient always give information in chunks and be very empathetic to the patient. Applied clinical knowledge and patient safety is equally important. That was about this first station. The next station. So this is again the patient simulated task. You're ST5 in the Urogynaecology clinic and you're about to see Mrs. Linda Cooper, who is 56-year-old and has had undergone TVT operation a year back for SUI. She's come for a follow-up visit. Consultant is away and ask you to examine. You are outside the cubicle. What are you supposed to note? Yes, you need to know what type of task it is. You need to know you need to know that you need to apologize because the consultant is away and she has undergone surgery. You need to ask, how is the recovery after the surgery? These three things are the main here when you start or building rapport with the role player. On examination, you find that there is an area of 0.8 centimeter mesh erosion and atrophic vaginitis. So here you need to discuss Mr. Cooper's concerns with her and reveal the findings to her and plan a management with her. So again, whenever you are outside the cubicle, see what are the domains that you will be assessed on: communication with the patient, patient safety, information gathering, and applied clinical knowledge. It will be either 3 or 4, but very rarely they will give all the 5. So whenever there is information gathering, try to take all the information gathering. Information gathering involves history taking, investigations, and examination. Okay, never stop with the history taking alone. It is history taking, investigations, and examination. Applied clinical knowledge, again, you need to know the details of the guidelines. Okay, so here the role play instructions. The basic thing is she's diabetic and she's sexually active. She's upset about the mesh erosion. So according to template, as I told you, start with the give good introduction, then apologize, then ask how was the recovery after the surgery. Again, you need to ask when she's coming alone and you know there are some complication, ask if she's alone. And medical and lifestyle history, very important. She's diabetic here. Never forget to ask up the diabetic. If she's diabetic and she's experiencing all these things and you don't ask the history, the marks will be deducted. So be careful to take focus history. Signpost and ask about the sexual history. These are the main things. Here, you can even ask about the mental history, family history, support, all this follows. But these are the things which you will never forget to ask in these type of stations. Communication with the patient, again, prepare and consent, apologize for the consultant, empathy and support, explaining the examination findings and condition. So after taking all the history, you need to say that I'd like to examine in the presence of Shifra. I can see that, Mrs. Cooper, that a part of the tape which you had put has come out, or it has just eroded the a lining of your vagina. I'm very sorry to say that. So this is the reason that you are having pain and also a pain during your intercourse. Give a pause, allow her to speak, and then move forward. And then you discuss the management options in a very simplified way. So patient safety, again, confirm patient identity and exclude allergies, examination in the presence of chaperone, national registry entry. So whoever has undergone TVT and has come with the complications like mesh erosions, you need to say them that we need to document or register yourself in a national registry so that it is for the audit purposes. Comprehensive management plan and importance of MDT. Applied clinical knowledge, again, if you have to talk about the national registry entry, management depends on the site of erosion, size of the erosion. Here, I can see that Mrs. Cooper, your tape has just gone to the lining of the tissue just beneath it. So what I can see that it is less than 1 centimeter. It's a very small one. We can apply some cream, what we call as an estrogen cream, for 3 months and see how it goes. Generally, women with diabetes and who has undergone can have this type of erosions. We will try to heal with this cream. Am I clear so far? So these are the things you need to explain in a very simplified way. Suppose if it is more than 1 centimeter, then you will refer to regional or supra-regional MDT, and you consider for partial or complete removal of the tape, and you have to explain that there could be relapse of incontinence for which she had to undergo this surgery. So this station, basically, you have to be very empathetic in the about the whole station because she has come with some complication after surgery. And the main thing here would be the national registry and explaining to her the size is small, applying estrogen cream for 3 months, and then to see how it goes. And to explain why this has happened, you can just say that because since she's diabetic, but never be judgmental saying that since you're diabetic and since your BMI is high or something like that, will make her feel that because of her diabetes, she has got this. Never say that. Can generalize and say that women who are generally on a higher side weight and also with the with the medical conditions like diabetes can have this type of complications happening more often than the general populations. So I'm very sorry that it has happened to you. So since this is a smaller size, we can apply cream for 3 months and then we go about it. Okay, so I explain in a very simple way and keep it as short as possible so that it's easy for the role player to understand and as well as you will save time. So this is the main thing that you are supposed to talk in this station. So let's go to the third station. This is a teaching task actually. You will be assist on information gathering, communication with the colleagues, patient safety, and applied clinical knowledge. So your ST5 Urogynaecology clinic, your junior colleague wants to know about urodynamics. She's new to this topic and confused with the graphs and terms. You have 10 minutes for this task. So these are the graphs that the junior colleague has got with her. So for any teaching station, there is a template to be followed, like introduction. You say that I'm Aysha instead of saying I'm Dr. Aysha to your junior colleague, so that the rapport is well established. Rule out bullying. Ask her how is everything in the department and why she's interested in this topic. Check background knowledge. Ask her, do you know anything about your dynamics? And make an agenda. The make an agenda means, okay, I will tell you what is urodynamics and what is indications and contraindications and interpretation of the charts. Encourage the junior colleague throughout, and whenever after you say some sentences, you can just tell her to repeat it. Always when you're asking them to repeat in order to save it time, ask simple questions and tell them, give the questions in such a way that they answer in one word. And involve the junior colleague throughout the stations and encourage them, saying that very good, you are a fast learner. Ask for feedback and then close the station. Again, here, according to the domains that will be assessed in information gathering, you will grade and check background knowledge. Why is the junior interested in the topic? And you need to ask about the patient history if the patient history is there. Do you know anything about the patient, about this chart? And usually it will be given in the exam. And review patient's medical history too. Communication with the colleagues, greet and establish rapport. Effective communication, clear and concise, seeks guidance, supportive and active participation. Patient safety, identification and consent, exclude allergies, explaining the procedure clearly, risk of UTI and hematuria with cystometry to be explained, and apply clinical knowledge. You have to talk about the urodynamics. First of all, what is urodynamics? You have to tell this is a type of test which is done to see about the lower uh, urinary tract. So what are the components that are involved? That is urophometry, urodynamics, cystometry, video urodynamics. Then you talk about how it is done, normal uroflowmetry. First of all, proper privacy for the patient, and the patient has to be very comfortable, wherein a patient, when he feels to pass urine, has to pass through a flow meter. And usually the normal uroflowmetry will be the bell-shaped. If it is not bell-shaped, then it is due to the obstructions. Cystometry involves both filling and voiding phases. You need to talk about the two transducers. One is kept in the abdomen, one is kept in the rectum, and the other one in the either in the rectum or vagina, or in the second one in the urethra, urinary bladder. So two catheters are placed that gives the pressure. One in the bladder gives the vesical pressure, and other one gives the abdominal pressure. They choose the pressure by subtracting abdominal pressure from vesical pressure. So this is how we will uh, take the cystometry. Okay. Now the junior colleague has come with the charts. Let's see how to interpret the charts. Here, can you see at the starting? It is vesical pressure, abdominal pressure, and retrosal pressure. Here, retrosal pressure is quiescent. There's no activity. But when the abdominal pressure, abdominal pressure is increased, there is vesical pressure increased. And there is a leak at the end. So this is stress urinary incontinence. So in the exam, it will not be given as a color code or anything. What you have to see is just check where is the vesical pressure, where is the abdominal pressure and retrosal pressure. And then see whether there is increase in vesical pressure when the abdominal pressure is increased. If it is there, then it is stress urinary incontinence. And see for the retrosal, if it is not increased, and then that means it is not a overactive bladder or retrosal overactivity. Coming to the next slide, next graph, here you can see the vesical pressure is also increasing when the abdominal pressure increasing, and you can also see a detrusor pressure increasing, and there is leak. This is mixed urinary incontinence. Suppose the abdominal pressure is not there, it is okay, and there is increased vesical pressure and increased detrusor activity, then it is detrusor overactivity. Hope this is clear. Okay, so so these were the three cases which I went quickly. And what are the important things? That is the asterisk points that you have to cover. That's very important. Try to be calm and composed. Try to go along with the agenda of the role player. Listen to the role player. Role player will give you a clue if you are not able to understand anything. And then if you have to be on the right track, saying that if you feel the role player is not cooperative, that means there's something wrong with you. I mean to say there's something wrong in which you are saying. So try to be as composed as possible, and nothing goes well. Can say that yes, I can put you in touch with my consultant who will be to explain in a better way. If you are getting sometimes there can be some mental block or something, don't worry. You have to use the plan D, like you can put in touch with the consultants, you can put in touch with the MDT and all those stuff so that the patient safety is covered. Okay, so important things in the urogyne is taking history and trying to be empathetic and trying to be, giving information in chunks because it's the elderly patients who will come to you, and be very empathetic. The next thing what I want to explain is, suppose you enter a cubicle and you see three people inside your cubicle. That means it's a one examiner, one lay examiner, and a role player. So this is a lay examiner tested task. You need to be empathetic with the patient. You need to be, try to signpost and ask for sexual history. Try to be as calm and composed. Try to be empathetic or very, um, explaining everything should be very uh, in a very layman language. Do not use jargons at all, because lay examiner will not like the jargons at all. So if you enter the cubicle and you see two, that means examiner and the role player, that means patient simulated task. You enter the cubicle and you see one, then that is a structured discussion. So these things I just want to tell you. Make use of the 2 minutes which is given to you. See what type of task. See the patient's name, and write down the main things which you are supposed to ask and which you are not supposed to omit at all in the uh, inside the cubicle. Make note of such points and try to finish those points first. The rest, once you start with the stations, then the flow will go. All the best to all of you for the upcoming exams. Thank you very much.